I'm Dr. Steve Hodges, a pediatric urologist at Wake Forest University School of Medicine. And I want to talk to you about Dr. Soother's Healthy Wipes product we developed here out of our research. So Dr. Soother's wipes are a biodegradable, fragrance-free, pH-balanced individual wipe. We sell in packages of varying sizes. And why we developed them was this. I'm again, pediatric urologist by training, and so I see a lot of pre-pubertal girls with irritation on their bottoms. This a lot of times gets blamed on yeast infections. Most of the time it's not. Most of the time it's just contact dermatitis from urine. Just the way little girls are designed when they urinate, they tend to stay wet down there, and that causes a rash. And we found that's actually a risk factor for urinary tract infections. It's also irritating, annoying, can be painful. So the skin pH and the bacterial flora of the skin change when that vulvitis happens. And these wipes, when used appropriately, can return the skin pH and bacterial flora back to normal. Since they're designed to treat a rash, they can also treat rashes other places. So we found, obviously, that not only dermatitis on the bottom it can be treated by these wipes, but also anywhere where you have a mild rash or a skin irritation. So they can be used elsewhere, but the original designation was for little girls. Not only can they be used in other parts of the body, but they can also be used by different age women. So postmenopausal women have benefit from these wipes because when you're not hormonally active in women, which is before puberty, obviously, and after menopause, you have the same kind of risk factors for UTI and skin irritation, and the wipes can help that. And they can even help women that are hormonally active, although the rate of irritation is less in those women. So I want to talk about how to use these wipes and what their limitations and benefits are. So what we decided the best way to use them would be after a child voids, or anyone voids, you wipe as you normally would with whatever you do to get dry, and then you take one wipe, you open it up, and I'll show you what they look like, and then you wipe the area very well, and you got to be pretty aggressive to clean the entire area. They're a decent size. We don't advise throwing them in the toilet. It's best to put them in the trash. So you wipe the area aggressively, clean it very well, and then you let it air dry, because you don't want to wipe off the astringent, because that's what helps the skin heal. If used regularly, and we recommend twice a day, but you can use them as often as you want. If you overuse them, sometimes you get drying of the skin. That's something, if your skin gets too dry, you back off. You can use them less. My kids tend to use them as needed. When they have an irritation, they use them, and it gets better, and they use them again as needed. If your child suffers from urinary tract infections, I don't want to make the case that you just use these wipes and everything gets better, because the skin is only one risk factor. Children that have infections, or anyone really that has urinary tract infections, typically has to make sure that their constipation is being treated well, and they're avoiding regularly, and don't have any other causes. But if the skin is an issue, these wipes will help. And again, they'll also help any mild irritation or rash anywhere in the body. We have a website, www.mysoothers.com, as well as a Facebook page, and we welcome any questions online. Thanks so much.